All right, so I'm going to show you short posterior with a stirrup. This is really common for tib fib fractures, any kind of ankle injuries. But when you talk to the provider before you start the splint, you want to ask them if they want any particular positioning, like any dorsiflexion or any pedal flexion, so that you know when you're splinting where you want to hold that foot once you get it on. This is going to be a two-parter, so you're going to measure using that bias. Remember, don't stretch it, just let it be slack. So the first thing that you're going to measure using the uninjured foot, we'd have the shoe off, and this would be from the toes down under the back of the calf. So from the side, if you want to take a peek, it's going to come about mid-calf. Again, that's going to be provider specific. You can ask them if they want the toes immobilized or not. In this case, we're going to go all the way to the ends of the toes. So this is our length for our posterior. So the posterior is always going to be wider. For this size leg, I'm going to use a 4-inch for the posterior. The stirrup can be narrower, so I'm going to use a 3-inch wide orthoglass for the stirrup. So I've got my posterior. I'm going to take my stirrup. When I measure the stirrup, we're going to go down underneath the heel and up to, again, about mid-calf, not stretching that material so we get a good measurement. Take that one. I've marked both of these so that I can remember which one is which. The longer one's the stirrup and the shorter one's the posterior. With this particular splinting, we only have to wrap the one time, but you do want to make sure that you get a good wrap on the ankle especially. That's where the injuries are most of the time. So you don't need an extra set of hands for this one. If your patient can tolerate it, Esme, can you roll over for me onto your stomach and then put your leg straight up behind you? I'll help you with that position once you get rolled over. Perfect. So yeah, if your patient can hold their leg, I'm gonna pull you back just a little bit more and point your toes down for me if you can towards the bed. That's perfect. If you can hold that position for the next couple minutes while I get you wrapped up, that'll mean I don't have to have an extra set of hands in here. So again, we're gonna wrap. We wanna get a lot of padding on here, especially over those bony prominences around the heel and the ankle. Most of the time I'll go with a whole extra roll and really kind of beef that whole section of the foot up so that there's not any rubbing or chafing that goes on with that orthoglass. Most of these folks are going to be non-weight bearing too, but you still want to make sure you get a lot of padding on. Padding should go, again, all the way to the toes, but we do want to leave the toes exposed so that we can get good CSM checks and keep an eye on the color. Make sure that they have good circulation. So I'm going to use that third roll to go over the heel and the bony prominences on the ankle. It might look like it's a little bit overkill, but it will really help the patient feel more comfortable in that because they're going to be in this for probably at least a week. All right, so now that we're wrapped up, sometimes the provider has a preference for whether they want the posterior on first or not. I usually do the posterior first and then I do the stirrup. So that's how I'm going to show it to you this time. So posterior, I'm going to go straight to the end of the toes here. It's just going to go up the back of the leg. And then I'm going to take a 4-inch bias, and this means I'm not going to have to wrap as many times and make as many overlaps. So because this is resting nicely, I'm just going to start towards the top of the calf. You'll see that this is just a little bit longer than it needs to be. I can roll that over and wrap the bias over the top of it so that that orthoglass isn't sitting right on the skin. I want to make sure that there's padding behind it. And I'm just using my hand to very slightly shape the orthoglass as I'm wrapping it. When you get here to the heel, you can tuck, but don't add a lot of pressure. Just tuck enough that you don't have sharp edges. and then wrap over the foot. And make sure you don't cover the toes completely. If you need to, you got some extra, you can roll that edge back too and capture it underneath that bias. All right. Once that roll's done, you only need to secure that with really just one piece of tape, because we're gonna have a second piece of ortho glass and more bias that's gonna go over the top of that. So our second piece is gonna be our stirrup. Our stirrup starts where at the very top of the wrap that we have. And again, we wanna make sure it's not on the skin. It'll hang nicely, so you don't need that extra person in here to help you out. I'm gonna start at the top and wrap. You wanna make sure you get a little bit of overlap so the top of the ortho glass isn't poking out. And then same thing, just lightly using your hand to kind of shape the ortho glass to the leg to follow the curve of the ortho glass that's already underneath this one. And this is a really particularly bulky type of splint that we do. It adds a bunch of extra weight. And you kind of want to prepare your patient for that. They're gonna get up and it's gonna feel real heavy. All right, once we get to the end of our roll, we're gonna use a couple extra pieces of tape on this one. Again, for your really active patients, you want to really get the sides taped down so that this bias doesn't roll. How's that feel, Esme?
Great.
Can you wiggle your toes? Okay, can you feel me touching your toes?
Yes.
All right. And we got good cap refill. All right, we got good toe exposure. We want to be able to see all the toes. So if you need any dorsiflexion or pedal flexion, this is your time to kind of lean, use your hand. Don't push down into the orthoglass to make dents, but apply like firm pressure over a broader section, and that'll help keep the orthoglass from conforming and creating any kind of like pressure points on the inside. So you can hold until this firms up, and once it's firm, you can get your crutches out and do your crutch training. That's it.